This is part B of chapter 7 on middle childhood psychosocial development. We just got done talking about the different parenting types and the discipline techniques. So now we're going to go on and look at the effects of parents working. So the majority of U.S. mothers with children under the age of 18 are in the workforce. So what is the impact of mothers' employment? Well, it depends on many factors concerning the child, the mother's work, her feelings about it, whether she has a supportive partner, the family socioeconomic status. Does the mom need to be working? Are they of lower income and maybe have a lot of stress? Also, the type of care and the degree of supervision the child receives. All of those determine the effect of the parent's work. So what research shows is the more satisfied a mother is with her employment, the more effective she is as a parent. So many different factors. The quality of care is very, very important. So poverty in parenting. Poor children are more likely to have emotional and behavioral problems and suffer cognitively and scholastically. So they might have lower self-esteem. They might get along less well with their peers, have lower achievement. And some of this has to do with poor parents are more likely to be authoritarian, to stress obedience. Remember how I talked about authoritative, the VE, the love, high in love? Those children tend to be most successful. So poverty in parent doesn't mean that every child of lower socioeconomic status is not going to do well. No, that's not what that means. It means that statistically speaking, poor children are more likely to have more behavioral, more emotional problems and other developmental issues. And some of that having to do with the stress related to maybe not having enough income, as well as the type of parenting that poor parents or parents of working class tend to have. So maltreatment, different types of maltreatment. Who is at greatest risk for abusing their children? Actually, mothers with multiple children and living in poverty. So the amount of stress that maybe a single mother has as she's trying to juggle taking care of the children as well as maybe working or living in poverty, those can be risk factors for abuse. So long-term effects of maltreatment, don't worry about watching this video. This is actually one of the TED Talks that we already watched, and I believe a past chapter having to do with the long-term effects of abuse and spankings and maltreatment. All right, so let's look at divorce. So divorce causes stress to all family members. Divorce increases the risk of antisocial behaviors, difficulties with authority figures, dropping out of school, emotional and psychological problems. Really, a child's adjustment to divorce depends on many different things, like the level of parental discord before divorce. Was there a lot of fighting? Did the child hear the parents fighting a lot? Was there a lot of stress in the home? If there was, then perhaps divorce or the family environment afterwards might be better for the child. It really depends on the level of parental discord before divorce, the child's age and maturity. The children that have the hardest time are those that are in their teen years, that are older. The gender and temperament, a difficult child is going to have a more difficult time adjusting to the changes of divorce. Psychosocial development before divorce, so a lot of different things. The parent's handling of the situation, custody and visitation arrangements, financial circumstances, all determine the impact of the divorce. So although parental divorce increases the risk of long-term problems for children, most adjust reasonably well. So children living in one-parent families are at a heightened risk for behavioral and academic problems. This is largely related to lower socioeconomic status. So what this shows is that family income may be most critical rather than really having one parent. So it's really one income that is the issue. The stress is related to having one income and maybe a greater likelihood of living in poverty are actually what create or contribute to the increase in behavioral and academic problems. Step family adjustment can be very stressful. Child's loyalty to an absent parent may interfere with bonding to the step parent. So step parents should make friends with their child slowly, rather than stepping in and demanding that the child treat them like a parent. It's better for them to be friends rather than step in and try to discipline. So living with gay and lesbian parents. Research shows that there's no special concerns for those children in terms of development. They're no more likely to be homosexual. They're no more likely to have social or academic problems. They tend to have a positive relationship with their parents. The only difference that research suggests is that they tend to be more accepting of diversity and different families. So sibling relationships become less physical when the youngest child turns 5. This probably has to do with theory of mind of the youngest child. When they turn 4, they usually have a pretty good sense or a theory of mind, and theory of mind is correlated with pro-social behavior and empathy. So that probably has something to do with it. So sibling relationships become less physical when the youngest child is 5. So birth order, the textbook got into the birth order and the impact on development. First children tend to have the highest expectations, have higher IQ. Only child tends to succeed more in school, have higher intelligence. Again, this is just overall. Does it mean that every first child has higher intelligence? Not necessarily. They're just looking at statistics and showing the overall trend. So the child in the peer group, so other social relationships. So the peer group becomes more important in middle childhood. They're going to school, they're having sleepovers, they're maybe participating in sports. So peer groups in middle childhood generally consist of children who are similar in age, in sex, in ethnicity, in socioeconomic status, as well as those that live or go to school together. All right? So positive effect of having peer relations. Friends help kids to develop social skills, allows them to test and adopt values independent of their parents, gives them a sense of belonging, and helps them develop their self-concept and gender identity. Now, the negative impact or effect of peer relations is that it can encourage conformity or antisocial tendencies, cliques, prejudices, bullying. So it's when you get a bunch of a group of peers together and you have this clique and you create this in-group and out-group. It can create some bullying, or it can create some prejudices. So popularity in middle childhood tends to influence future adjustment. Behaviors that affect popularity may derive from family relationships and cultural values. So you can categorize popularity of children by popular, rejected, neglected, controversial, average. Authoritative parents tend to produce more popular children. The authoritative, the VE, right? The lots of love parents with boundaries and rules. So friendships, boys tend to have more friends, girls tend to have closer ones. That's what the research tends to show. Aggression and bullying. During middle childhood, aggression tends to decline. Again, theory of mind, age 4 and continuing to develop. Instrumental aggression is used for the person to get their way, generally gives way to hostile aggression aimed at hurting the target, often relational and social. So when you're little, you tend to see kiddos using physical force, hitting, slapping, things like that. And as they get a little bit older into middle childhood, it tends to be more relationship aggression, bullying, name-calling. So highly aggressive children tend to be unpopular. Aggressiveness is promoted by exposure to media violence and can extend into adult life. So research does support that violent media does have a negative impact on the way that children behave. So children that watch negative media may be more likely to use aggression to get their needs met. more likely to use aggression to get what they want. So middle childhood is a prime time for bullying. So you're going to watch these different videos on bullying. This one right here, this Key and Peele bullying, shows that bullies may have some internalizing issues going on. This video does have some swearing in it, so just want to kind of warn you, you might not want to watch that with kids in the room, but I think it makes a good point overall. Okay, mental health. 10% of children, 1 in 10 children and adolescents are diagnosed with mental disturbance. The most common is the disruptive behavior disorder, and they involve ADHD, oppositional defiant, and conduct disorder. Oppositional defiant has to do with being defiant, going against authority figures. All right. Conduct disorder is more going against the normal conduct of society, violating society's norms and hurting others. So phobias and other anxieties are some other mental health issues. So separation anxiety, social phobia, generalized anxiety, OCD. Childhood depression. Mood disorders are characterized by symptoms such as prolonged sense of friendlessness, inability to have fun or concentrate, maybe fatigue, extreme activity or apathy, like an I just don't care, a feeling of worthlessness, weight change, physical complaints, and thoughts of death and suicide are some of the symptoms of childhood depression. Treatment techniques for mental health issues, you have individual psychotherapy, family therapy, behavior therapy, drug therapy, different types of treatment. So stress and resilience. As a result of pressures of modern life, many children experience stress. Children tend to worry about school, their health, their personal safety. Resilient children are better able than others to withstand stress. So protective factors involve family relationships, social support, cognitive abilities, personality, degree of risk, compensating experiences. So resilient children are those that have social support. These are children who weather adverse circumstances and function well despite challenges, and they tend to bounce back from traumatic events. Different protective factors, so make sure to read through all that and watch all the videos from this outline.